In this video, I will be demonstrating on how to insert an indwelling Foley catheter on a female client. The client is Mrs. Jones, and after checking my doctor's orders to ensure I have an order to replace a Foley catheter, I would come to the room and explain the procedure to the patient. After explaining the procedure to the patient and the patient has agreed, I would gather all of my supplies. My supplies would include a Foley catheter kit. I always bring also an extra set of gloves, of sterile gloves. This is a sterile procedure and must remain sterile throughout the entire procedure itself. After getting my supplies, coming back to the room, I would wash my hands, explain again to the patient, identify my patient using 2 patient identifiers, namely name and date of birth, but be sure to follow your hospital policies. After I have explained the procedure, I will go ahead and prepare to insert my indwelling Foley catheter on the patient. For this patient, I am going to lower my camera so that you'll be able to see what I'm doing. The bed, I would normally bring the bed up to a working height. I cannot, for whatever reason, get this bed to move. So here we go. I'm gonna lower my camera just so that you can see Mrs. Jones fully. And you also want to ensure that you are just exposing what needs to be exposed on the patient. And I would expose her at the very last when I'm getting ready. At the moment, I'm gonna go ahead and just open my supplies. Remember, everything that we do is sterile. I am going to open them here so that you can see what it is that what I'm doing. All right, so I'll open my kit and remove it and of course, I've done hand hygiene and placed on just, clean gloves, and so I'll move this here. I'm gonna adjust my camera just a little bit more. Actually, I'm going to move my camera over to the table so that you can see me opening my supplies, and then I'll show you how we will transfer them to the bed. So you always open the first corner away from you. So we're opening our Foley catheter that way, and then we will open again this way, and then this way again, and then your very last corner comes towards you. Be careful not to touch anything more than that little 1/2 inch border around your Foley catheter, because all of this kit is, again, very sterile. Okay, so now that I've got that, what I would want to do on her is do perineal care to make sure that she is actually clean before starting any procedure on her. I will hold on to my little bag. Sometimes I'll use it as my trash receptacle. And then what we're going to do is that we're going to open her covers, and we will go, I'm going to turn my camera back so that you can see what we're doing here. So we'll open the covers, and I want to cover her this way. All right? You will place her into the recumbent position. If she is able to hold her legs over, then that would be absolutely perfect. So you can do that. You can also solicit help if you need someone to help you. All right, and here's my sterile gloves. I'm gonna just put everything. I normally would do everything over by the sterile field, but I'm gonna try and do things so you can see what I'm doing. So sterile gloves, we open them and ensure that you only touch this part here and then your hands in. And a lot of times what I'll do is I'll step back from over my sterile field with my sterile gloves. So that one, and once I've got that one on, I can touch the rest of the gloves on this side and straighten them out, okay? So gloves in. Now I have sterile gloves. So everything inside of my kit is now sterile and I can touch. I'm gonna use my little drape here. Shiny side goes down, okay? And that's just gonna make myself a little extra to the patient, okay? I don't really use this fenestrated drape at all unless I'm doing a male, but it's totally up to you. And for the purposes of this video, I will actually use it, but I normally don't use it unless I'm doing a male patient. It does help to keep the penis from falling back over. So I'm just gonna put that there, but I only usually use it on the male. You also wanna make sure your patient is not allergic to iodine, because these do have iodine in them. If they are allergic to iodine, then we would use chlorhexidine to clean our patient to still make it sterile. Okay. So I'm gonna actually move this little straight on the bed, just so you can see what I'm doing. I'm gonna try and stay off of my sterile field on the bed. You really still can't see much of that, but I'll move it up so you can see what I'm doing. All right, so this little box here, and this has your iodine swabs in it, so you would open these. This has your lubricant. You would open your lubricant, and you would put your lubricant in the tray, because you're gonna use it to lube your Foley catheter before inserting. So we got a little lubricant there. We will open our little swabs. The patient is not allergic to. I'm not going to use these on this patient because of the iodine. I don't want to stain the mannequin. But we would use all three of these. We have some sterile water that will hold our Foley catheter in place. We will take that one. And what we're going to do with that one is we're just going to attach it to our Foley where we would insert right here. We don't push any water in it or anything like that. We would just attach it, okay? And so now I'm gonna take this out and I'm gonna put it in the lubricant. I'm gonna put this in the lubricant and lube it up really good. Probably a good couple of inches on that, and then it will just kind of stay, and we can put it back in our box if we need to, all right? Now that once we've got all of that, patient is clean, we've cleaned her, we're now going to contaminate our non-dominant hand. Our dominant hand remains sterile at all times. So with this, we would actually let her know, Mrs. Jones, I'm gonna be touching you now, and you would spread the labia, and we would take one of our little swabs, and again, I'm not gonna swab her because I don't want to stain the mannequin, so we don't use these on the mannequin because it's iodine. So I would swab down once on the side opposite me. So on that side, just down once. Then I would get another one and I would swab the side closest to me. So now I'm gonna one swipe down on this side over the meatus. And then the very last swab, because there are three that comes, I'm gonna swab straight down over the meatus. And you can see the meatus here, right there, okay? That goes into the urethra. So with mine, loop tube, I'm now gonna let her know, a little bit of pressure, Mrs. Jones, we're coming in with our Foley catheter, and we would just insert. And we would insert until we get urine. And once we get urine, we would advance it a couple more inches, 3 more inches or so, and then we would take our little bitty saline or still water, I should say, and push it in, and what it's gonna do is create a bubble. So we would just push in all the water and then screw it off and then take it off the patient. So now we have an indwelling Foley catheter. Our sterile part is actually over. We would clean our patient up and we would leave this. Now we have to, and this kit does not have one in it, but we would also have to use a stabilizer to stabilize this part of the Foley catheter on the patient's thigh or lower abdomen, because we want to make sure that it doesn't pull or anything like that. Make sure if your order says that you're to get a urine specimen, you have a urine specimen inside of your kit with the lid. Make sure that you get it as you are placing the Foley catheter. At this point, you can take it from the bag. Later, you cannot take it from the bag anymore, but when you initially put it in, you can take your sample from the bag. And then that does it. After we do that, we would hang it on a part of the bed that does not move, but it needs to be hanging lower than the bladder, and clean the patient up, and you would monitor your urine output for the patient. So thank you so much for watching this video. I hope that it will help you as you are placing in an indwelling Foley catheter. So at this time, I'm just gonna clean up around her. And again, I would place everything in the appropriate trash receptacle, and that would be it. Thank you so much for watching.